Alex. I'm doing my cardiac video. I'm going to scan the room to show that there is no script. Okay. Alright, before I walk in the room, I'm going to look at the chart, wash my hands, and then as I walk in the room, I'm going to close the door for privacy. I'm going to introduce myself. I'm Alex. I'm going to be your student nurse today. Can I get your name and date of birth?
Gage Belko, February 19th, 1994.
Okay, and then it's going to be a routine checkup. That's the reason they're here. Are you experiencing any pain?
No.
No. Alright, and then I'm going to start my assessment by starting at the head. His hair is full. There's no patches, no thinning. It's thick. Skin is warm to the touch. It's got has pink undertones, normal for ethnicity. Doesn't seem to be in any respiratory distress. Accessory muscles are not working, or I don't see any use of the accessory muscles. So I'm gonna check for pulses and his carotid pulses, or carotid artery pulses. Right under the jaw. +2. Middle, +2. And then the base of the neck, +2. I'm gonna do it on the other side. Okay. Alright, both are +2, bilateral. I would also at this point test for JVD. Since there's no table, since I don't have a chair that can go to 45 degrees, I would lean the patient back and then look for distension in the jugular vein, and there would be no JVD. I'm also going to auscultate. I'm going to listen with the bell. I put it on the wrong side. Okay. Alright, can you take a deep breath and hold it? Okay. 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 No sign of bruise. Pulses are normal sounding. Let's see. So now I'm going to listen for lung sounds. I'm going to go across using my diaphragm to check for any. I wear these all the time. Okay. You just take a deep breath for a minute. Okay. Just breathe normal. Okay, so breath sounds were clear. There was no adventitious sounds, no ronchi, no crackles. I'm also going to listen to the eighth man. So I'm going to look at the aortic. I'm going to look at pulmonary, Erb's point, tricuspid, and mitral. Okay. Heart sounds are good. S1 and S2 are there. There's no S3 or S4. No heart murmurs. I'm also going to have the patient. Can you turn for me?
Mm-hmm.
Thank you. All right. I'm going to now ask the patient, say 99.
99.
Thank you. One more time.
99.
Okay.
99. 99.
All right.
99.
Okay. And then I'm also going to put my thumbs together and ask the patient to inhale first so I can check for symmetry. Okay. All right. There's symmetry. Let's see. I'm now going to listen to the posterior lung sounds. All right. Just breathe normal. Okay. Lung sounds are good. There's no adventition sounds in the posterior. No crackles, no bronchi. All right, you can turn. Also noticing in the back, he's got some macules and there's a tattoo, but other than that, skin tone is normal for ethnicity. Pink undertones. There's no lesions, no scarring. Now I'm going to check for pulses. I'm feeling for temperature first. Patient is a little warm, so semi-clammy. I'm going to check his pulses for his radial pulses. All right. I would say that they're bilaterally equal, but I would say they're bounding, so +3. I'm also going to check brachial. Okay, +2. I'm also going to test strength, so I'm going to have him squeeze my fingers. Okay, that's strong. And then can you push? Okay, and then pull. Okay. Patient's range of motions are great. Strength is strong, grip is strong. I'm going to check tap refill now. Check for that just to make sure that they have good circulation. It's less than 3 seconds in the left. Alright, the right is good. Alright, okay. I'm also going to move now down to his legs, his lower extremities. I'm going to feel for the popliteal pulse in the back of his knee. Alright, I have a +2. Let's see. I'm also going to check the posterior tibial pulse. Alright, +2 as well. And now I'm going to check the dorsal. Right there, +2. Now I'm also going to check calf refill. Okay, plus calf refill filled within 3 seconds. I'm going to have him do some leg raises. Can you raise up your right leg for me? Okay, thank you. Can you raise your left? Alright. And then can you push on my hand like a gas pedal? Okay. And then can you bring your feet up? Alright. Feet strength is normal. Range of motion is normal. So after my assessment, I would wash my hands, thank the patient, and then see if the patient needed anything, make sure he's safe in bed, and then I would walk and wash my hands, and then walk out. Okay. Thank you.
Welcome.
Alright. I'm gonna edit this part out, but I feel like I missed something. Where's that blanket at?
Blanket.